This has been a heroic project. Over 100 people. How many institutions did you say? 11, all across the country. Researchers, practitioners, and the vendors. I'm really glad it's over. But I'm glad it's over actually for a good reason. That there's been a lot of work done here, and it's about time that work got out and got applied. So the research can go on forever and get published in research journals and have no impact. And what I would love to see is that the results here do have an impact. Now, it's interesting if you look at the title. The title is EHR Usability and Patient-Centered Clinical Decision Support. Last night I asked Jaji what he thought the most important result was of these 4 years. And he said it's EHR usability, that in fact there is now a standard the government is imposing that you must test the usability of all of the systems. Notice it's about the top part. So there are two components, EHR usability and clinical decision support. The usability is important. It's essential. It's not the most critical thing. In fact, if usability is done right, we should take it for granted so that we can focus on what's really important, which is the clinical decision support systems. We must have usability, and whether the particular standards that have been invoked are the correct ones or not doesn't matter personally, because having those standards brings people's attention to it. So that this means all of the vendors will be hiring UX specialists, that over time things will get better and better. And the standards have to also include one more thing, which I don't think are in them now, which is usability in practice. It's very easy to test usability in the laboratory. There's a big difference when you actually watch people on the floor of the hospital, the floor of the emergency room, the floor of the operating room, the floor of the urgent care facilities, where, for example, as we just saw in this wonderful slide presentation that Jaji showed, when you turn your head away for a few minutes, the system logs you out. So I have watched nurses using these systems write the information on their hands. The whole point of digital records is so we don't have these kinds of writing errors and handwriting deciphering. And they're not even using paper, they're using their hands. And when I once asked them why they're writing that on their hands, they say because first of all, there's no computer in the patient's room where I need the information. And second of all, I'm always going to be interrupted, right? The average time between interruptions is a couple of minutes for a nurse. And then the system logs me out. So these are the sorts of things we have to worry about, which is the workload, the interruptions that happen. Thank you. Speaking of usability. Which reminds me, Jaji's slideshow was excellent, but it missed actually one very important thing that happens to me every time I go to my position, which is, what is your name? What is your address? What is your date of birth? Well, that's okay, all reasonable. But then I go down the hall a few feet, and what is your name? What is your address? What is your date of birth? Et cetera, et cetera. Then I get myself weighed, and I stand on a digital scale, and it gives me the digital readout. And then somebody has to go over and read it and write it down and type it in. When I'm at home, I stand on my digital scale, and immediately that number is on my cell phone and on my website. And so one of the difficulties that we face in medicine, for that matter, any complex environment, is integrating together all the various sources of information that already exist in appropriate form, but where there was no thought of integrating it in the beginning. And one of the problems the vendors face, those of you who are vendors, you have a really difficult job because all of you have fairly large, complex systems. And in most cases, they're legacy systems. They've been around a very long time, and they're very, very difficult to change once you have them. It doesn't matter how well-intentioned you are. It doesn't matter how many people you throw at it. It's an extremely difficult problem. And this problem has plagued every industry. It's not just healthcare. It plagues the air traffic control system. It plagues the internal revenue system. It plagues large companies with their accounting systems, their payroll systems. So it's a really difficult job to make these changes. They must be made, but it's going to be very hard. It already is very hard. Now, of those two tasks, the usability one is the one that I think we've made the most progress on because it's the easiest. But I also think the most important part is the one that still requires research, and that's the patient-centered clinical support system. How on earth do we present the information in a way that actually is quickly intelligible to the attending physician, to the nurses, to the technicians, and to the patient? And as you all know, that's extremely hard because the information is entered through a variety of different places, different clinics, different hospital settings, the referring physicians, different hospitals, in different formats. Every physician has their own particular way of representing the information. A lot of it's in free text. That's where we must do the research, and that's where we must continue to do the research. And I would hope to see over the next few hours some interesting directions in which we must move. So, but those are the two parts of this program. The usability, which I think is a more straightforward problem to talk about how it should be done, but a very difficult problem for the vendors to actually implement because you're not starting from scratch. Academics always love to tell you how to do things, but academics always assume that you're starting from scratch, from zero. And that's never the case. You always are starting with existing systems. And then the second part is how should that information be presented? How should the various formats be combined into one understandable graph? So you showed a very nice screen where there was a picture of the patient and everything is laid out very nicely on top of the picture of the patient. But that's going to be really hard to do. That's the challenge for the next few years. And I'm glad these 4 years are over because now we can start to apply what has been learned and then start the project that we'll do the next 4 years. So thank you very much.